Okay, I'm Denise McKenna from the Mental Health Resistance Network.
Sorry, I didn't hear that.
I'm Denise McKenna from the Mental Health Resistance Network. The mental health activists have mainly in the past campaigned against psychiatric abuses. So when all of this stuff happened, we weren't really organised or we weren't really used to campaigning against a government as such. We were used to campaigning against psychiatry. But we did, in late 2010, we formed the Mental Health Resistance Network and as a one-issue organisation, and that one issue was the work capability assessment, which we all know was horrendous. One of the things that we thought was this is awful, it can't be legal, this cannot be legal. And we contacted Liberty, and they wasn't something they would deal with, but somehow or another we were directed. We found ourselves at the Public Law Project, which is a charity legal organisation. And I spent a lot of time working with them to try and identify some way that the work capability assessment could be challenged for people with mental health problems. One of the things that never having I have no knowledge of legal matters, a little bit now, I know a little bit more now than I did then, but I was going in with a clue of what could be done. You know, I'd heard of what a judicial review was. I thought we could have a class action. I'd read an article in The Guardian, and I think it was Zoe Williams had written, I don't understand why people with mental health problems aren't having class action against this work capability. So I thought, yes, that's what we should do. So I met with the solicitor at the Public Law Project. He and I spent endless hours, and you know, him in his office, me in my flat, going through all the regulations and whatever, to try and identify a point of law. I mean, I didn't even realise that a judge couldn't say, this is disgusting, it's immoral. I didn't realise that. I now know that all they can say is, this is illegal. So, you know, I mean, you know, the government can go around guillotining people if they want. If it's not illegal, a judge can't stop them from doing it. So really, I was kind of limited in what I could contribute by way of saying, this is a point of law. I was kind of dependent on the solicitor, and what we had to do was in order to get legal aid to do it, the Mental Health Resistance Network, we had no money, but if ever there came a time when we had funding, we didn't want to find ourselves lumbered with a huge bill. So it was decided that we would have a couple of individuals who would put themselves forward as the people in whose name the judicial review would be, and I was one of those people, and there was another person, and we had a few other people who were also whose stories were also being contributed to the case. Our argument was that the work capability assessment was it discriminated against people with mental health problems because it failed to make reasonable adjustments by virtue of the fact that it depended on people self-assessing. In other words, people at an interview saying what their problems are. And the argument is that they're up for all sorts of reasons. People with mental health problems find that a difficult thing to do. Not helped by the fact that very, very few of us, if any, are actually psychiatrists or psychiatric nurses, very few of the assessors. And what we were asking the judges to decide on was what we were requesting was that the Department of Work and Pensions should take responsibility right at the outset of a claim for obtaining medical evidence from the person's own practitioner, so their own psychiatrist, their own doctor, their own psychiatric nurses or whatever. And I mean, there were discussions in court, first of all, about whether it really discriminated against us, because they were saying, well, who are we comparing these people against? Who are they being treated less favourably in comparison to? Was it other disabled claimants? Was it people who couldn't claim? Well, they were saying, well, people who weren't claiming, it was irrelevant because they couldn't claim anyway, by virtue of the fact, you know. But anyway, all of that was very technical. But but really, the DWP were arguing that there was no way they could prove that this would help, blah, blah, blah. Whatever it was, we were saying that it could reduce the number of people who would have to fill in an employment support allowance 50 form, an ESA 50 form, because they could identify straight away who would really not be able to work, or it would reduce the number who'd have to be called up for the actual assessment. And the other thing is this, and this is a thing I've noticed this government are doing a lot, is there are lots of exemptions but they don't tell anyone about them. And one exemption one thing about the work capability assessment is, I can't remember the exact wording, but if not being found unfit for work would cause a significant harm to yourself or other, then you should not be found fit for work. So basically, we were saying that as it stands, the work capability assessment had no way of assessing risk. Had no way of assessing risk to the person or to anyone else, and really it would require the person's someone who knew them to help with that initial assessment, because we didn't think that a person in the work capability assessment would themselves say, well, actually I'm at risk. Not necessarily, they might do, not necessarily. So anyway, that's it. We've not had a judgment yet, we're still waiting for that judgment.
I couldn't understand why I hadn't heard of it, but that's why.
Yeah.
So when was the case heard?
The case was heard on the 30th, I think it was the 15th, 16th and 18th of January, so it was 3 days. Right. It was in the upper tribunal. We had asked, it was going to be in the High Court. We asked that it be in the upper tribunal because they are the people who've tended to deal with appeals. So there's that. So we're still waiting for a judgment on that, and we will be meeting up with the charge. We'll quickly rethink to decide on a response. But there are a couple of things that made me that I became aware of throughout this whole process. One of them is it's very difficult for people that are fighting these cuts to actually make links with the legal profession, because for most of the law seems very remote. Lawyers and barristers seem very remote, and there's all the expense. It's very expensive getting legal help. So I mean, one of the things that I would like to see is some kind of way of campaigners linking up with the legal profession. So that we're, and I'll give you an example. So we recently set up our Facebook page, and someone wrote and said, look, there's this law whereby people under the age of 30 cannot have private accommodation at a one-bedroom flat. They've got to share with someone else. And she says, I
was under 34.
I just put the limit up.
She said, I suffer from severe social anxiety, and this would be devastating for me. Now, of course she's quite right, and it's not appropriate for someone with a severe mental health problem to be sharing with someone. It's not appropriate. I mean, for example, schizophrenia quite often emerges in early 20s, late teens, early 20s. Is it appropriate for someone who's at the beginning of having a schizophrenic breakdown to be sharing a flat with someone else who suffers from severe depression? Is that appropriate? I don't think so. So, you know, we're in a situation where we're kind of, and I think the other thing that I've become very aware of is just how marginal mental health has been in virtually everything that has been done, and remarkable given that mental health claimants form a significant amount of people who are claiming. So the other thing, and I do intend doing this, I want to do this, is to campaign to make sure that, you know, there's this disabled thing of nothing without us, about us, and this very much applies to, and in a way that seems to have been the argument for people with physical disabilities, but we very much have to make it also particular to mental health, because quite frankly, and even the new guy who's replacing Professor Harrington to do the independent review, he's no mental health expertise, you know.
But it's no coincidence that the legal aid is cut for all the benefits work on the same day that they're bringing all the cuts in. So those links, and I agree, they're hard to make, are going to be harder to make because there's going to be less people able to do the work.
But I mean, for me, the other thing I became aware of. The other thing that I'm very aware of is that when we're not in crisis like this, it's still very important to make sure that protective laws are put in place. So you know, I mean, people with mental illness, we should have been fighting for better. I was just putting up on our Facebook page a thing about the mental health discrimination law, or whatever it's called, that's proceeding through Parliament. And it's things like a person with mental health problems should be allowed to become an MP. You know, if they've been sectioned, they should be allowed to be a company director or whatever. But these are all things that of course, it's important, but they're not really the everyday things that affect us. For example, we've still got community treatment orders in place where people can be forced to be drugged in the community.
I think we're probably...
Oh, I'm sorry. Sorry.
Need to wrap up now and try and keep it to the benefits issue.
Yeah. So no, it's just that I realise that that mental health is has been marginalised. That we have been fighting benefits issues on the grounds that there are exceptional circumstances for mental health, and I'm a little bit apprehensive about that because, of course, the whole thing is dreadful that's happening to all of us. So that's it.